Hemal, great to see you. Welcome to this episode of Vartalap. I think I'm seeing you in on online after 16, 17 years to be exact. How are you doing?
Doing good. Yes, it's been a long time that we met and probably saw each other physically.
So I'm
It's
pretty
been going
jealous of
good.
you. You are in sunny California, one of my favorite places. So for my viewers, Hemal Parekh is a solutions architect currently based in California. He has more than 15 plus years of work experience, primarily around PeopleSoft and other ERPs. Anything that you wish to add, Hemal?
I think that's about it. Yeah, more on the IT side, on the business applications, and been in multiple places. India being the primary, and in Europe
Mhm.
and US.
Okay. So we are in the midst of coronavirus. How are things in California? The California governor has been in news. I have been seeing some things popping out here and there about California governor. How is that for you?
I would say probably much better to be in California compared to the East Coast,
Uh-huh.
for sure. The way it's been handled.
Yeah, yeah.
But yeah, I would say being in California, the if you see the statistics, it's uh, the count of number of cases have been like 28,000 to 30,000 now that have been identified, and the number of fatalities is more than 1,000
Mm-hmm.
in California.
Mm-hmm.
So yeah, I mean they've done their best compared to the other states within US, and California being the place where more of an Asian and more of the foreign people travel because of the IT or because of the business purpose.
Mm-hmm.
It is one of the place where it was expected to be more, but I think the California governor took a steps well in advance compared to the state. So I would say the fertility ratio and the spread of that has been curtailed what it could have been, I would say. But yeah, still not what could have been the best.
So when you say curtailment, is it because of more testing or is it because of lockdown?
I would say the curtailed the transmission because of the lockdown initiative that was imposed,
Okay.
and California took a step well ahead of time. So that was, I think, good. And the spread by the time it happened
Mm-hmm.
to the transmission stage where it is out of control,
Mm-hmm.
the way it happened on the East Coast side, I think before that could reach that stage, it was curtailed through the lockdown, which is good.
Okay. I mean, there are a lot of news also coming out in terms of creating, making a vaccine. Is something like that also happening in the state of California? Is the governor pushing for something?
Right. So I think it's all across the world, I would say that's been going on. But
Yeah.
the fact is, we don't have a cure as of today.
Okay.
And the vaccine is, when I'm saying this, so there are two parts. One is the cure, which is a medication which heals up the patients who are having COVID-19.
Mhm.
And second is a vaccine so that it doesn't, you don't catch it, right? So these are the two options that typically the healthcare has got. For vaccine, it's not going to happen at least for a year from now because it has got its own 12 to 18 months or 20 months of cycle. So it's not going to be there.
Mhm.
Now, the only hope is a cure, which again may not be the best way out here, but the latest studies that's been there from the Gilead Sciences, which has been doing a research in Chicago hospitals, they're able to cure quite a lot of patients. Again, that is something which is going on, but there's been not a formalized proof happening still. So hopes are there, and I would say the prevention is better than cure.
Mhm.
And the current situation, the way it's been a pandemic for sure across the world, across the globe. All economies are down,
Mhm.
deaths have been there. I think the best is to keep the hope, follow the guidelines for the government, the local government, what they are saying. I think that is the
Mhm.
best way.
So in terms of prevention, is something happening in terms of boosting people's immunity? Because that's something which has come up off and on in a lot of research papers as well. As a lot of people are advising that you should boost your immunity while you're staying indoors so that you don't catch. Apart from prevention with masks and whatever you can, there is also talk about boosting immunity. Have you heard something like that in California as well?
Yes, so I mean that is something which is true. Again, the thing specific on that side has been done in California, which I'm aware of. But yeah, I think the immunity is a key thing, and to make that really good for each and every individual, I think the most important thing is you have a healthy diet, a good diet. So I think one of the key thing is, the easiest thing is cut short on what you are eating and buying outside. Try to have it more home cooked and made it within the home, which is going to be much more sanitized comparatively. So I think that is what is probably generic norm, but nothing specific in California. But I would like to maybe point out one thing which is applicable globally. Since you don't have a cure, immunity for sure is the only way. That is the maybe in a way a cure. If you're immune, you get cured. If you're not immune, then probably you get susceptible to that. Now, with that being said, I feel at this juncture, the one of the key thing is for all age group people, uh, contain yourself with regard to the food, home cooked food. But I think more important is going back to the roots, is basically going for the, even I feel taking the homemade cures to improve your immunity is one of the critical thing. Using turmeric, like the all thing that's been talked about in Ayurveda scientifically, and as well as what is with the literature, probably is the best way in the current situation until we have the vaccine. I would say that is the best way.
In terms of fatalities in California, have they been more in the 60 plus age group, or how has been the distribution, if you know of that?
I would say the ratio, the stats, what I could think of is among the 28,000 what's been identified of now, the majority of the cases who have caught it is again in the age group of 30 to 45 that's been infected. But yeah, fatalities are more, the fatality ratio, if I may have to say, yeah, is more on the senior people.
Okay. So your parents are still based in Gujarat, I believe. What's the news that you are getting from there?
My parents are in Indore, Madhya
Okay.
Pradesh,
Ah, okay.
and so yeah, I think among all the top cities, at least until yesterday, so Indore was having 500 plus infected, being a small city compared to the big cities, the metro cities like Mumbai and other cities. So the count is pretty high. It's in the red zone for
Yeah.
sure.
Yeah.
So I think the way Indian government has taken a step to have the lockdown, which is again lockdown has got an asterisk. The lockdown that's been put in US is different from the level of lockdown which is put in India. In India,
Okay.
is more like a very strict lockdown. You're not supposed to step out. There is a police or there's been a institution in place who is actually supporting the ecosystem, but you're not supposed to step out. Whereas in US, people are allowed to step out. They are allowed to walk. They are allowed to go for a biking, but ensuring a social distance. So
Okay.
with that being said, the way the dynamics of India and US are different, I think I would like to touch upon that, where you have more density, controlling things in India becomes more difficult
Right.
uh, because it's more dense population. Second is the way the life has been there, it becomes very difficult if it actually transmits the way it has got transmitted in US. So with that being said, within Indore or the hot pockets like Mumbai, Pune, Ahmedabad, where it's already been crossed 400 plus infected people, I think it's been very critical that the way the extension has happened, people do follow it. And I think more important is what we are actually getting in a way. I think maybe more for everybody to be aware, the lockdown extension is not the solution. I think it's a false hope to keep on government that after 2nd May, things are going to be normal. No. What we are trying to do, or the government is trying to do, is get more time so that healthcare can be improvised from infrastructure standpoint and supply chain standpoint. And second, you have it more like a controlled mechanism wherein the number of cases that are coming up can be addressed to the healthcare system. I think that is what government is trying to do. But that is, I think the normally for business, for economy is not going to happen. I don't say it's going to happen at least for the next 2 to 3 months or maybe longer.
I'll come to that, what happens after 3rd May in India. But you touched upon a point, the differences between lockdown in India and US. So, as you said, if you want to go out for a walk or bike, are you also supposed to cover your face, have a face mask, and those kind of things? Are they being also sought, or is there a strict following of something like that as well?
Good point. So here it goes by the recommendation,
Okay.
but citizens are free to do whatever they want to do.
Okay. Okay.
So that's the difference. That's what I'm saying. Like in US, the
Uh-huh.
way it's been implemented is different. The strictness, the way you see in India, this is a rule. You have to follow it. Again, there are multiple reasons for it. The priority is for all the face mask is being for all the healthcare and critical service and goods providers. So I think that's where all the health masks are being consumed. So for the normal people, it's not easily available. So that's one of the key challenge. Many
Okay.
people are going like restoring to like homemade masks. I mean, but again, that is has got its own ifs and buts. Are they really preventive? Are they really effective enough? There are a lot of questions there, and hence I think with all this situation in place, so the social distancing has been put as a norm for sure, and that's been followed across in all the stores wherever you go for walking, stepping out. Everything has been followed. But masks is many people do it, and many people they don't do it. But there is nothing like if you're not following it, you are been caught, made accountable now.
No penalization basically. Okay.
No penalization.
Okay. So something also different is happening while we are under lockdown, which is earlier the software or IT industry was synonymous with working from home. Now almost everybody who is into professional life is kind of working from home except the exempt services who are still out on the streets. That's happening. Plus, there is also a clamor for a lot of sanitization. Then there is a lot of usage of delivery apps, which is happening. There is a lot of emphasis on consuming digital content that is happening. So we are seeing a growth in some of these sectors. Do you think that will last a long term? Something like demonetization came in as a way for digital payments. Again, something like this is helping digital payments. People are working from home and learning new things. There is a competition which has been put together by government of India or Ministry of Telecommunication or IT to create a video conferencing app for India. So there are a lot of things which are changing. How do you see something like that?
I think it's a good point. I think any change that happens for a short duration, people go back to their comfort zone.
Yeah,
But this change has been, people are able to force it longer
yeah,
than what they would get expecting. So I think a couple of key changes is one in their working style. When you talk about a service industry, essentially people who have never been accustomed to remote working and having the meetings remote, I think many of them are getting used to that. That is including your government hired, which typically are not comfortable with. So I think that's more like the situation has pushed people to adopt that. So that is more on the working style. Now talking about your logistics, your way of doing business or way of uh, commercial procuring and everything, the supply chain, everything. I think, yeah, so that has gone. It was, I think, with Amazon, the way it has brought in to have your online shopping, it was already like that direction had got started. But with this being in place, each mom and pop shop is also now adopting to that. So one of the thing what has been coming up as a terminology here for the grocery shops is curbside pickup. You order online, you go, you get to the entrance gate and you pick it up your order. So
yeah.
I think that is happening not only for the big stores, it's also happening for the mom and pop shop here.
Right. I mean, coming to the digital content piece of it, you see a spurt of content that's coming through Netflix, even old content, Doordarshan showing
Correct.
Ramayana and Mahabharata. So people are becoming more attuned to it. I don't know how that will affect the viewing patterns going forward in next, maybe once the lockdown is out. How do you see digital content being seen by people?
Good point. I think, yeah. So on that aspect, yes, I think the moment people started realizing, they were expecting probably the Netflix, Hotstar, like all the service providers,
Yeah,
uh, logins are going to go up and the revenues are going to go up. And that is true.
yeah,
People sitting within the house and have nothing else to do, and they minimize their stepping out maybe once in a week. You got a lot of time, ample time in home. And the way to do it is either you play the board games with your kids and family, and second is go to the digital content. And for recreation, for a human, recreation is part of the life,
yeah.
and that is the only way which is there. So I think it's going to change the way it's been looked out for many of the people, and specifically the new generation is much more adaptive. But I think the people in the age group of like 35 to 50 and senior are getting accustomed. So I think the change is happening.
Similarly, for digital payments as well, I mean, there is again a spurt into the way UPI apps are being used, a Paytm or a MobiKwik, and the government using its Jan Dhan mechanism to transfer money into accounts of landless people or farmers. So again, there is a spurt which has come in suddenly after demonetization.
Correct. But I would say probably from the online payment app standpoint, the digital payment standpoint, I think the biggest change was during the demonetization. So
Yeah.
I see for mostly for the India, that is not a big change impact, I would say. I mean, that was I think the first big change. I think this is now like a smaller
Mhm.
compared to the change impact standpoint. But yeah, I think with this happening, it's going to become more like a norm now.
Okay, yeah. So coming to one last query, you mentioned about what happens post lockdown. So in India, lockdown is till 3rd May, and already we are seeing that since zones have been districts have been divided into zones, red, orange, and green. So possibly there would be some restrictions in certain zones, and some districts can start economic activity. How do you feel this will pan out after 3rd May in India?
Yeah, I think that zone wise, the way steps have been taken to at least get started with the essential commodities business, I think that is critical for livelihood sustenance. But I think there are a few industries which will remain in red and will not be able to kick it off, like tourism industry, your hospitality industry, your commercial aviation. I'm expecting it's going to be a big question mark. Transportation, everything is going to be, because people, even if on 3rd May government lifts the ban, people are not just going to jump. They're going to be pretty much reluctant. They're going to ensure the social distancing, and they'll be thinking, I would, instead of 2 times, they're going to think 10 times before they make any step, any buying or being in the common area. So all that luxury shopping is going to go away, is going to get impacted. So all those things which are not in the circle of essential things are going to get impacted for sure.
Sure. Yeah. I mean, things like malls, cinemas. I think tourism. You hit rightly. They will not become active pretty fast. But utility industries like construction or even machinery or commodities, they will need to be started again surely. Otherwise, I mean, the people who
Correct.
are dependent on it, there are more than 2 million laborers working in these industries, and you need to provide succor to them. Government cannot write paychecks again and again without impacting the fiscal deficit. So that's going to be there. How is the lockdown scenario? I mean, will you be in lockdown for a longer period in California, or how is that for you?
Again, so in here also, it's more like as the time passes and how the case are coming up. So the lockdown for sure is until April end.
Okay.
And from the school district standpoint, from school standpoint, I think it's been said that the current session, which typically is till May end,
Mhm.
is going to be online, no schools. Kids are going to meet directly in August. So they've
Okay.
given a clear direction for the
Mhm.
kids specifically,
Okay.
which also talks about your other ecosystem, the government sectors, wherever they are functioning. Everybody is trying to do wait and watch, only the essential things to move on. Very much similar to India, I would say. It's just the strictness is good is of different level. But here also it's like wait and watch and extending day, depending on weekly basis. They are connecting and seeing how it should be moving forward.
Yeah, I remember Donald Trump saying he wants to kickstart the economy from 1st May. Let's see how what happens there.
Correct, that's true. But I think it's going to be more phased. Kickstarting the economy cannot happen like with all industries getting fully functional in full throttle.
Yeah.
Again, if green signal is given, nobody will be doing it, and
Mhm.
the consumers are going to be reluctant. So it has to be consumer-driven industries, right? So it has to be depending on how much appetite the consumers are having to take it up.
Cool. That's been a good conversation, Hemal. I believe our viewers would have something to listen into. And thanks for your time today. I hope to have another conversation with you, maybe on some other topic in future. Thank you. Thanks for your time today. Wish you a great day and safe. Stay in house till the time at least lockdown is there. Stay healthy. Thank you.
Thank you. Same to you.
Bye.
Take care, Aman. Bye.